Think coffee causes high blood pressure? Think again. Stick around as I bust that myth and 4 more that could be harming your health. Hello, I'm David from the Pharmacy Corner. I'm here to break down health topics in a clear, simple way with key facts and practical tips. Let's get started.
Now let's talk blood pressure. You know, that silent force pumping through your veins every day. High blood pressure, or hypertension, affects nearly half of adults, but so many myths float around that keep people confused and stressed. Today, we're tackling 5 common blood pressure myths, backed by solid evidence from trusted sources like the National Institutes of Health and the World Health Organization. I'll debunk them with quick facts, share tips to sort fact from fiction, and tie it all to real ways you can take control. These hypertension misconceptions could be tripping you up. Let's bust them wide open. Ready? Myth number 1. You've probably heard it a million times: cut the salt, and your blood pressure will plummet. Sure, salt plays a big role, but here's the myth: thinking it's the only villain. Too much sodium raises blood pressure by making your body hold onto extra fluid, forcing your heart to work harder. But according to the World Health Organization, high salt intake is just one piece of the puzzle. Other culprits include diets loaded with saturated fats and trans fats, low on fruits and veggies, plus physical inactivity, tobacco use, excessive alcohol, being overweight, and even air pollution. Genetics and age crank up the risk too. In fact, the WHO notes that unhealthy diets overall, not just salt, drive about 30% of hypertension cases worldwide. So, if you're slashing salt but still munching processed snacks or skipping walks, you might miss the full picture. Here's a practical tip. Don't just eye the shaker. Read food labels for hidden sodium in breads, canned soups, and even cereals. Aim for under 2,300 milligrams a day, but balance it with potassium-rich foods like bananas and spinach to flush out excess. Start small. Swap one salty snack for a handful of nuts. You'll feel empowered, not deprived. Viewers, if this resonates, drop a comment. What's your biggest salt struggle? That morning ritual, your steaming cup of joe. The myth? One sip, and boom, your blood pressure skyrockets forever. I get why this scares you. Caffeine is a stimulant, after all. But let's clear the air with facts from the National Institutes of Health. Over the short term, coffee intake can nudge your blood pressure up by about 10 millimeters of mercury for up to 3 hours, especially if you're not a regular drinker. It's like a temporary alert mode for your body. However, habitual moderate coffee consumption, 3 to 5 cups a day, doesn't raise your long-term risk of hypertension. Some studies even suggest it might lower it, thanks to antioxidants like chlorogenic acid that protect your blood vessels. In one review of over 500,000 people, daily coffee drinkers had up to a 15% reduced chance of developing high blood pressure compared to non-drinkers. The key? Consistency builds tolerance, so your body adapts without the ongoing spike. Tip time. If you're new to coffee or have hypertension, start slow and monitor your numbers at home for a week. Black or with a splash of milk is fine, but skip the sugary lattes that add empty calories and hidden sodium. And if caffeine jitters hit, switch to decaf. It has trace amounts but all the flavor. Turns out, your brew might be more friend than foe. Cheers to that. Moving on to myth 3. Exercise spikes your blood pressure forever, so why bother? I hear this from folks worried about that initial pump during a workout. Your systolic pressure can jump 20 to 50 points while you're huffing up a hill. Scary, right? But the truth, straight from the Centers for Disease Control and Prevention, is the opposite. Regular physical activity lowers your resting blood pressure over time. The CDC says just 150 minutes a week of moderate exercise, think brisk walking or swimming, can drop systolic pressure by 5 to 8 millimeters of mercury. It's like giving your heart an advantage. Stronger muscles mean easier pumping, less strain on arteries. Long term, active folks cut their hypertension risk by up to 30%. That temporary spike? It's normal and safe for most, building resilience. Here's some straightforward advice. Start out with a 10-minute walk after meals. Track progress with a home monitor to see those wins. If you have existing high blood pressure, chat with your doctor first for tailored clearance. Exercise isn't the enemy, it's your secret weapon for steady, healthy numbers. Myth 4 hits close to home. You can always feel high blood pressure coming on, like headaches or dizziness screaming danger. Wishful thinking, but not true. The National Institutes of Health calls it the silent killer for a good reason. Most people have zero symptoms until it damages your heart, kidneys, or brain. Up to 80% of cases go unnoticed without regular checks. Only in crises. Readings above 180/120 might you get blurred vision, chest pain, or nausea, but that's emergency territory. Early on? High blood pressure can have no symptoms. That's why the NIH pushes routine screenings. One quick cuff can save lives. The best advice is don't wait for warning signs. Get a home monitor and check weekly, same time daily, arm at heart level. Log trends and share with your provider. Many folks think symptoms are key. Now you know, prevention beats reaction every time. You're taking charge already. Last up, myth 5. Stress is just in your head and won't touch your blood pressure. Oh, if only. Chronic stress, that nagging boss or family worry, floods your body with hormones like cortisol, raising your pressure temporarily each time. Over months? It contributes to sustained hypertension. Medline Plus from the NIH explains. Stress tightens arteries and amps heart rate, mimicking a fight or flight loop that wears you down. Studies show stressed folks have 20% higher odds of high blood pressure. But here's hope, managing it works wonders. The NIH links relaxation techniques to drops of 5 to 10 points. Here's a nudge. Build a 5-minute daily ritual, deep breathing or a quick journal. Pair it with herbal teas like chamomile, but check for interactions if you're on meds. Remember, acknowledging stress is step 1 to lighter loads and steadier pressure. We have covered a lot. Salt's not solo, coffee's mostly cool, exercise empowers, symptoms hide, and stress sneaks in. These blood pressure myths busted with facts from the NIH, CDC, and WHO mean you can ditch the fear and embrace smart habits. Tips like label reading and home monitoring? They're your toolkit for real control. Trust the evidence, not the rumors. Just a quick note. This video is for educational purposes only, not medical advice or diagnosis. Always consult your healthcare provider before making health decisions.
Thanks for watching the Pharmacy Corner. David here. If this helped you understand your health, please subscribe for more clear tips. What health topic would you like next? Stay well.